Hello, I'm Dr. Brandt Gibson, and one of the big questions I'm asked is when should you cast, splint, or boot a fracture? Now, the idea is if you have a fracture, the best thing you can do is rest, ice, compress, and elevate. One of the big ways that we can rest a fracture to keep from stressing across that fracture is to put it into a splint, boot, or cast. And so the big question is, when should you do that? Well, anytime you have an injury, you're going to want to do something to immobilize it so it doesn't move as much. As we talked about previously, swelling will do that to a degree, but the best thing you can do is find a way to splint it or boot it or cast it so that it can actually minimize that pressure. If you have a fracture that's unstable, the best thing you can do is put it in a cast, put it in something that completely stabilizes it. If you have a fracture that's the complete opposite, that is stable, stress fracture, a little crack in the bone, those kind of things, a lot of times you don't need to put it in a major splint, boot, or cast, but you can just be careful and not overdo it. Anywhere in the middle, basically, you should be looking at and saying, okay, how much discomfort do I have? If I have a large amount of discomfort, and what I would say is if you have pain from 1 to 3 or 1 to 4, then there's a possibility that you can actually function at that level. But anything higher than that, you should be doing something to decrease the pain, because pain is an indication that you're still stressing that fracture. Then you can actually make it worse if you don't immobilize it in some way. So if you have a fracture and you're saying, okay, my foot or ankle or whatever is hurting quite a bit, and you're trying to figure out when you should cast it, if the pain is above a 4, especially when you're using it, then it should be immobilized. Now, if you find that the pain starts at a 3, but as you go through the day, it gets above a 4 or 5, a 6, or even higher, then you absolutely want to immobilize this and either put it in a cast or a boot, something that keeps it from moving altogether. And if you're casting or booting correctly, or even splinting correctly, your pain should significantly decrease, if not go away. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 312. When should I cast a fracture? Well, the easy and short answer is you need to cast a fracture anytime the pain is sufficient that is interfering and keeping you from doing the things you're doing. Because when you put it in a cast or a boot or even a splint, a lot of times you can return to normal activities with a protected fracture so it doesn't get worse. Thank you, and have a great